A 62-year-old man was admitted to the hospital because of marked shortness of breath and peripheral edema. His personal history is that he's had pneumonia a number of times over recent years. He smokes 1 to 2 packs of cigarettes a day for nearly 50 years and is still smoking. And on physical exam, he's thin, has a respiratory rate of 20 per minute, which is borderline elevated. He's hypertensive at 162/90, and his heart rate is somewhat increased at 92. His peripheral oxygen saturation is poor at 84% on room air, but on 4 liters of oxygen, it's 91%. So this is telling us already that there's significant lung disease here. His jugular venous pulse is also elevated at 14, so right atrial pressure is increased. He has distant lung sounds, and when you ask him to take a deep breath, there's not very good air movement. His heart sounds are distant and hard to hear. He has an enlarged liver with the margin felt 4 centimeters below the right costal margin, and he has 3 to 4% peripheral, 3 to 4 plus rather, peripheral edema extending well up on the leg. His EKG demonstrates right ventricular hypertrophy, and a chest X-ray shows hyperinflated lungs with multiple areas of atelectasis or scarring, presumably from previous pneumonia. So what are the critical things we want to think about here? First of all, of course, he's short of breath, and so that says heart or lung disease. He's also had peripheral edema, so we're thinking possibly there's going to be heart failure involved here. His history of all this smoking for many years tells us there's liable to be lung, possibly, and heart disease. He's had pneumonia many times, and of course he's still smoking and has a huge cigarette smoking history. His respiratory rate is a little bit fast. His blood pressure is elevated. He's hypertensive. And, of course, he has markedly abnormal oxygen saturation, suggesting that there is significant lung disease. His JVP is elevated, suggesting that there's right ventricular failure with elevated right atrial pressure. There are distant heart sounds with poor ventilatory capacity. That's telling us, okay, we've got some signs here that are going to suggest very severe lung disease with some pulmonary hypertension, possibly causing right-sided heart failure. The heart sounds are also distant because there's a lot of air trapping. And again, the enlarged liver suggests that that's congested because of right ventricular failure. And of course, he also has edema. His EKG demonstrates right ventricular hypertrophy, and this suggests that he has pulmonary hypertension leading to right ventricular failure. His chest X-ray, of course, shows hyperinflated lungs with multiple areas of atelectasis or scarring. No surprise given his smoking history. And here we see his EKG. You can see the very tall R wave in lead V1, suggesting pulmonary hypertension, and that's the cause, of his peripheral edema and his right ventricular failure. And you can see another characteristic there. There's deep S waves over the left precordial leads, corresponding to the large R wave in lead V1. There's also right axis deviation, also part of the right ventricular hypertrophy EKG pattern. And he has tall P waves, so-called P pulmonale, commonly seen in advanced pulmonary disease. This is right atrial enlargement. And remember, jugular venous pulse told us that he had high right atrial pressure. So we're not surprised to find right atrial enlargement on his EKG. And the diagnosis is RVH, right ventricular hypertrophy. And here we see a chest X-ray. Notice how far the diaphragms are pushed down, and notice how the heart is vertical. This is a man with severe emphysema. The lung fields have minimal vascular markings. The lungs are hyperinflated, and there are the flattened diaphragms, a typical chest X-ray from somebody with severe emphysema. So, chronic obstructive pulmonary disease, and the echocardiogram shows a dilated right ventricle with decreased systolic function. Left ventricle is functioning fine. The estimated pulmonary artery systolic pressure is 60 millimeters of mercury, quite elevated. So therefore, and we know that that's what happens when people have severe end-stage lung disease. And of course, his right atrial pressure is elevated. So the diagnosis is right ventricular failure, secondary to pulmonary hypertension, which is the result of severe chronic obstructive pulmonary disease. This is called cor pulmonale, that is the lung heart. And of course, we know smoking causes damage to the lungs and eventually leads to pulmonary hypertension. The left ventricle is normal unless there's concomitant coronary disease, which could happen in somebody who smokes this much. And this form of heart failure, as I mentioned, is called cor pulmonale heart failure secondary to lung disease. Treatment, diuretics help with getting the liver congestion down and the peripheral edema. We want to maximize lung function, so he's got to stop smoking. Cor pulmonale doesn't respond to the same medications used for systolic left ventricular failure, so in the end, diuresis and pulmonary rehab would be the best treatments for him.